Hello, everybody. This is Temitayo, your host at Tooth Traffic Nigeria. Tooth Traffic Nigeria is all about increasing the level of oral health awareness in Nigeria. And with this dental platform at Tooth Traffic Nigeria, you can connect with a dentist anywhere in Nigeria, any state in Nigeria. So we're just a DM away. Just connect with us and we connect you with the right dentist. Okay, let's talk about today's topic: cracked tooth. What's a cracked tooth? A cracked tooth is just a crack on a tooth. Simply stated, crack on a tooth. This is a very common dental condition that we see on the teeth in the mouth here. You can see on this picture, you can see the crack going this way like that. Just follow the red button showing you where the crack is. That's a crack on a tooth. This happened to one of my patients. Suddenly, while chewing, you just heard bang in the mouth, and that was it. So that's a crack on a tooth. Anyway, what are the possible causes of a crack? Some of us like chewing on hard meal. We chew on bone like as if the bone is the food we're trying to eat. Some of us like to use our teeth to open a bottle of drink or beer, as if your teeth is an opener. Please. This is one of the cause. This is one of the cause of a cracked tooth. We should all note this. Another thing is that cracked tooth can occur in people's mouth with age. As you're growing older, your teeth are prone to cracks because of the wear and tear. Of course, you've been using your teeth since you were young till getting to 40, 50, 60. You can imagine what those teeth have gone through. So the wear and tear, when you put a new tire when you fix a new tire to your car and you drive it for about 6 months, you will notice all the wear and tear on the tire, Happy. So it's just the same thing. You use your teeth regularly to chew, so your teeth needs maintenance. And as you're growing older, of course, the teeth are prone to cracks. That's just it. Another thing that could cause it is grinding of teeth. Some of us grind our teeth and clench very hard. Some people grind and they don't know. If you are in this situation, you can speak to somebody that usually sleeps beside you to just watch out for you in case you grind or something. So they can tell you. So the next thing you should do if you grind is to see a dentist. There are different specialties in dentistry. Some people deal with this type of dental condition, grinding. They can help you with it. Then when you have a large fillings on your teeth, with large fillings, obviously the remaining tooth tissue are minimal. So the remaining tooth tissue around this large fillings are prone to cracks and even fracture, because when you chew, there's a lot of force going into your teeth, and these remaining teeth structures while chewing are prone to cracks. Trauma is another possible cause of crack on a tooth. When you talk about trauma, we have people that are into sport, especially contact sports, footballers, boxers, and all that. Trauma from contact sports can cause fracture, commonly to the anterior teeth. Some people when they're involved in a road traffic accident or some form of accident like that, and the upper and lower teeth have to actually hit each other with force, and there can be a crack, usually affecting this posterior teeth. So this is another common cause of cracked tooth. Sudden change in temperature. Some of us love chewing ice block. They know themselves. They love chewing ice block like something like their food. So this sudden change in temperature and the fluctuating temperature usually makes these teeth prone to fracture. Let's talk about the types of crack. Before we talk about types of cracked tooth, please let me just tell you about the normal anatomy of a tooth. Look at the red button here. This is the tooth and this is the enamel. You can see the enamel. You can look at it according to the labelings. There's the dentine, and the inner part is the pulp, which is soft, so it contains the blood vessel and nerve. So the crack can affect the enamel, it can affect the dentine, and when there's a communication between the outside and the pulp, you should know there's a problem. Okay, the first type of cracked tooth I'm going to talk about is a craze line. Craze line is the simplest form of crack that could affect a tooth. Look at the picture here. You can see those those arrows showing you the tiny cracks, like hairline fractures on the teeth. These are crazed lines and usually affect the enamel. So this is usually not associated with pain, and so no treatment may be needed. But I will see advice if you don't know the cause of all of these crazed lines on your teeth. Please visit your dentist. Let your dentist check and review you and advise you appropriately. Another type of crack I want to talk about today is fractured cups. Fractured cups. This is like a when the surface of a tooth or teeth that you use to grind, usually the posterior teeth, get chipped off. A part of it gets chipped off, and it's very common with teeth with large fillings. You can see it in this picture. Look at the large filling here. Look at the remaining tooth structure. You can see there's a crack actually occur here. So the part of the tooth, the cups got chipped off. So it's common with teeth with large fillings, and so the surrounding tooth tissue remaining are prone to cracks and fractures. So if the chipped part of the tooth is the enamel, there might not be any pain. But if the chipped part involves the dentine, the patient might start having sensitivity to cold drink. You drink water, wow, I'm having this shocking sensation in my mouth. So please visit your dentist when you notice the crack. Then I usually tell my patient, please, if you have a crack or a fractured tooth and you can see the piece of the fracture, please hold on to that piece of tooth, keep it properly and show it to your dentist. Your dentist might be able to reattach it to the tooth in your mouth, nothing like your natural teeth. And if that one is not possible, then the dentist can put the filling and do the appropriate treatment. Okay, so like I said, it's very common with tooth with large fillings. This is another type of cracked tooth. The crack might affect just the crown and it doesn't go below the gum. Look at this tooth here. Can you see the crack? The crack stopped here. Usually this is the level of the gum. This is usually the level of the gum. If this crack is above the gum, then this tooth is treatable. So please visit the dentist as soon as possible. If it's below the gum, below this place, look at the crack down here. From up here down here, most of the time this teeth might not be treatable. So I usually advise my patients, I advise people to see a specialist in dentistry, like an endodontist. An endodontist is a specialized dentist that specializes in making sure your tooth remain in your mouth, making sure your teeth are healthy, and an endodontist will make sure they keep in your teeth in your mouth as much as possible. So with this type of crack now, if you have this kind of crack and you don't visit your dentist early, these cracks and this particular type of crack can actually give way and extend to this. At the end, you will not lose it. So that's why I say when you think you have a crack or you see any sign of crack in your mouth, please visit the dentist so that the right treatment will be given to you. So patients with this kind of crack usually have pain on chewing, and it's even worse when they try to release the bite. When you stop chewing, the pain will just come very sharp and stop like that. And some of them, they have sensitivity to cold drink, to heat, or when they take chocolates, they start complaining that I'm having this shocking sensation. Over time, this particular condition can become worse and they have swellings and it leads to infection. So please see your dentist as soon as possible as you have any form of symptoms coming from your teeth or from your gum. Another type of cracked tooth is the split tooth. Split, as it's as simple as as you're saying it, split is split. The tooth is being splitted into two halves or something. So like I said earlier, always see a specialist. Like this condition now, an endodontist can still save part of this tooth. The tooth has been splitted into half. An endodontist will remove half of the tooth and then treat the other half in your mouth appropriately and still keep it in the mouth, and it will be able to function as a normal tooth in the mouth. So endodontist will try as much as possible to keep your tooth in the mouth. Split tooth, that's just it. So some of these teeth can be saved and some might not. The dentist might not be able to save it, but the specialist might be able to save your tooth that has been split into, usually the teeth that are multi-rooted, teeth with multiple roots. so they can be able to do something about it. So please, when you have any sign of crack, like I said earlier, see your dentist as soon as possible. What should you do if you think you have a crack? If you think you have a cracked tooth, visit your dentist, of course. The dentist will do proper examination, investigation, and give you treatment options that will depend on the type of crack, that will depend on the location of these cracks, and that will depend on the extent of the crack. So when the dentist says any form of crack, they tell you the type of treatment option, which may range from no treatment to even extraction. Some teeth might actually need to go through surgery for it to be saved. So the main thing is for you to visit the dentist, and the appropriate treatment will be given to you. How can we prevent cracked tooth? You know, I stated the type of cracked tooth that might occur naturally. Like as you are growing old, you've been using the teeth for so many years. Of course, the wear and tear of the teeth we make this teeth to be prone to fracture. To cracks. So this is just a natural sequelae. But to prevent cracked tooth, you try to brush twice daily with a fluoride containing toothpaste. The fluoride in your toothpaste will help. Usually fluoride help makes your teeth stronger. So you use a fluoride containing toothpaste to brush twice daily and not. Then you avoid chewing on hard food. Stop using your teeth to be breaking bone like you're a crusher. And so stop using your teeth to open a bottled drink and all that. Then if you are into contact sport, use mouth guard. Mouth guard will do magic. We prevent you from having fractures. We prevent you from having cracks. We even prevent you from losing your teeth. So it's like a cushion. Then you visit your dentist for help if you think you grind when you sleep or even during the day. The dentist will be able to help you. The grinding force is quite much. You can imagine grinding your teeth every time, the effect on the tooth. You can see, just imagine it, or the grinding of teeth is not too good. It will have a negative effect on your teeth. Then visit your dentist as early as possible when you think you have any form of dental symptom. Any form of dental symptom is actually very serious. Please visit your dentist as soon as possible. What are the possible complications of cracked tooth? When you have a cracked tooth, what are those things that could happen? You have a crack on your tooth that is simple. You do not have no pain, nothing. Over time, this crack can extend to the dentine, and you start having sensitivity, and you still ignore it as it's just a minor pain. This crack can now, the crack can now give that there will be communication between the outside, the oral cavity, that is your saliva, the bacteria inside your mouth, with the pulp inside the tooth. That's the soft part of the tooth. Bacteria will enter here. There will be while things are seeping between the crack, gets to the pulp. The pulp will be injured. You start having pains on chewing. You start having pain on chewing. The time will come that the pain will just come on its own without anything initiating the pain. Over time, the infection will be so serious that we have a swelling. You might have abscess in your mouth. Abscess that will contain pus. You can imagine your mouth will start smelling. Just imagine how the thing will progress and become worse. And at the end of the day, you can imagine going through all this problem, then you now lose that tooth. That is why I will keep saying it. Please, when you have any form of symptom in your mouth affecting your teeth, affecting your gum, any part of your mouth, please see a dentist. If need be, you'll be referred to the right specialist. Okay, so please trust a dentist. Damage to the tooth may not be obvious, like I stated earlier, like the crazed line thing. It might not be obvious because there's no pain, nothing. And it may be obvious. Either way, please just see your dentist regularly. Go for regular dental checkup. It is very important. Like we always say, prevention is better and cheaper than cure. Do you think you have a cracked tooth? You can ask somebody to check your teeth out, or you have one, you've been having this small sensitivity. Do you think you have a cracked tooth? And if you want to connect with a dentist and you need a referral, you can just send a DM to Tooth Traffic Nigeria. I'm here to help you out. We can discuss, I can advise, and connect you with a dentist anywhere you are in Nigeria. So, like I always say, I'm just a DM away. I'm here to serve you. I'm here to help you. I'm here to expose you to everything dentistry. So you can follow Tooth Traffic Nigeria on Instagram, and you can follow me on YouTube to Traffic Naija TV. We are here. This is a dental platform to increase the level of oral health awareness in Nigeria and to connect with you. And I hope what this topic for today, I hope I've been able to reach out to 1 or 2 people, and of course I hope, of course, hundreds of people, and whoever is seeing this video can share with any other person, and from there we are helping one another. So please follow at True Traffic Naija. Follow my go check my post, my previous post on different topics. You can make sure you're going to learn 1 or 2 things. Okay, thank you for watching this video. Thank you for listening to this talk. God bless you. See you again. Bye bye.